In recent years, my practice has largely focused on dealing with patients who have problems related to their current breast implants. While the overwhelming majority of patients who have breast implant surgery are happy with the results and report that they would have the operation again given the opportunity, there is a significant number of patients who experience complications and suboptimal outcomes that may require revisionary surgery. This is such an important part of breast surgery that I recently co-edited a book on revision breast surgery, which now serves as the standard textbook for plastic surgeons on how to deal with patients that have implant-related problems. A few examples of the kinds of things that we see. Capsular contracture refers to a condition where the patient's body, which forms a layer of scar tissue around the implant, begins to contract. Those women, when the scar tissue capsule contracts, it can cause firmness and deformity of the breast and even pain and tenderness. So we see patients that have that problem, and it can very effectively be treated surgically. We also see patients who have ruptured or leaking breast implants, saline or silicone implants. We can deal very effectively with these problems. Modern breast implants contain what's called memory gel, which is a cohesive, highly cross-linked silicone gel. Therefore, if the implant shell ruptures, the silicone doesn't escape. It doesn't go anywhere. It doesn't leak into the body or even into the breast. It remains confined in that pocket that we surgically created for the breast implant. We also see patients who have other problems like waviness and rippling. Sometimes this occurs in women who've had breast implants for a long period of time. The tissues become very thin and attenuated. Often we see this in patients who've had multiple previous breast implant procedures. We now have some very effective new methods to deal with these problems, things like the use of acellular dermal matrices, which are grafts of skin without any living cells, so it's just the collagen fibers either from animals or from humans. We also frequently employ autologous fat grafting, where we harvest fat from one part of the body and inject it into the thinned out areas of the breast. This has proved to be very effective for correcting some of these abnormalities like waviness, rippling, and palpability of the implant.